Lisa is a 72-year-old female brought in by ambulance from an adult foster home with increasing altered mental status. She was reactive with cares and decreased oral intake and weakness with her ADLs. Now admitted for failure to thrive and awaiting placement, as patient is not being accepted back to the adult foster home that she was previously residing in, given her behaviors and complexity of cares. Lisa has a past medical history of dementia, bipolar disorder, and type 2 diabetes on metformin. You receive a report from the night shift nurse about how the evening went and are ready to start your shift. The nurse and the CNA discuss the patient and provide handoff to start the shift outside of room 512.
Hey Cameron, I'm your aide for room 512.
Morning, yeah, how are you?
I'm good.
Yeah, so this is Lisa. She is in 512 here. She's a full code. Came in last night for a little bit of agitation, failure to thrive situation from her assisted living facility. Baseline seems to be like a one person, front wheel walker to the bathroom, just min assist. Consistent carb diet, so we'll definitely need to check her blood sugar, AC and HS, and then, potentially UTI as well.
Oh, okay. Is she confused at baseline?
She's oriented times 2 right now to herself and a little bit of place, but not at all oriented to situation or time. So let's keep an eye on her, offer some reassurance if we need it. She's also having a little bit of trouble using her call light.
Oh, okay. I will remind her how to use that, and then I'll check her blood sugar and vitals, and I'll give you a call.
Perfect, thanks.
Good morning, Lisa. I'm your nursing assistant. I'm here to check your blood sugar and your vitals before the nurse comes in to get your medication.
Who are you? What are you doing in my room?
You're safe. I'm here
Get out of my
I'm
house.
here to help you.
Get out of my house.
I'm here to help
I
you.
didn't ask for your help. Get out of my house. Get out of here.
I
Get
need
out of here.
staff in 512.
Get out of here. Can't get this out of here.
This scenario has escalated to a code gray, or code related to unsafe behaviors. This patient's behaviors have created an unsafe environment for the caregivers and the patient. Here are the next steps that staff should follow in initiating a code gray and ensuring scene safety. Keeping in mind that patients who meet the See Me, Still Me pathway may not adjust well to an acute care setting.
Hey, what's going on?
Hey, I came in to check her blood sugar and her vitals, but then she got really defensive and she's trying to hit me with her call light.
We clearly need to make this a code gray. I'm going to do my best to de-escalate her while we get security. Lisa, stay in bed. We're going to keep you safe.
Get out of my house. Get out of my house. I'm going to call the police. Get out of my house.
Okay, Lisa is exhibiting unsafe behaviors. I'm going to activate a code gray. Let's all step outside of the room to maintain caregiver safety. Okay, I'm going to call the code gray. Hi, my name's Jennifer. I'm the charge nurse on 5 West. I'm activating a code gray in room 512. That's room 512. Please, thank you. Cameron, would you like me to page a doctor for you to see if we can get any PRNs for Lisa?
Let's go ahead and do that. That'd be
Okay,
great.
I'm gonna
Thank
go-
you.
I'm gonna go ahead and do that.
I'll stay here and monitor her.
Okay, sounds good.
Code Gray, 5 West, room 512. Code Gray, 5 West, room 512.
Once the code gray is called, staff and security will create a plan outside of the patient's room to ensure everyone is on the same page and to maintain caregiver safety.
All right, thanks for coming over so quick. This is Lisa. Our CNA this morning started to grab her blood sugar and she started just to hit staff. She is threatening to kick us as well. Situation is definitely not safe. We've tried to verbally de-escalate her. It's just not working. She's not able to be reoriented at this time. We went ahead and paged the provider too.
So I did get an order for a PRN, IM and oral Haldol if she needs, and the doctor's on their way to the bedside right now.
Thanks for grabbing that.
After the code gray, staff and security will debrief and develop a safety plan specific to the patient. During this time, a risk for violence sign will be placed on the patient's door, which will indicate the level of violence. For this situation, Lisa would be a level 2 for verbal and physical threats against staff.
Okay, she's doing a little better now. Let's definitely make her a 2-person assist with all cares going forward, especially anything to do with the bathroom. It seems like right now she's mostly de-escalated. Jen, what do you think about adding a violence?
I think that's a really good idea, Cameron. I went ahead and grabbed a risk for violence sign because Providence doesn't tolerate any workplace violence. Let's go ahead and put this on the patient's door, and then I'll contact the house supervisor so they can add the risk for violence flag in the patient's chart.
Once a risk for violence sign is initiated, ensure a risk for violence flag is added to the patient's chart by either the house supervisor, assistant nurse manager, or nurse manager. Once the violence flag is entered, the patient's name will be highlighted red for caregiver awareness.